Hi, today I'm going to give you a brief on a device that helps to treat kidney diseases, which is magnetic resonance urography, which is also known as MRU. What is MRU? It is a device used for imaging to evaluate or detect blood in urine, kidney or bladder stones, and cancer in urinary tract. MRU does not involve exposure to radiation. It can detect abnormalities that might be obscured by other imaging methods. MRU uses radio wave that naturally exists within body. After scanning, the computer processes the signal. Urine have very large T2 relaxation time. Heavily T2 weighted pulse sequence generate images with high signal intensity from static fluid. Static fluid MRU demonstrates the collecting system, ureters, and bladder. Coronal static fluid MRU shows obstruction of the right distal ureter in a patient with prostate cancer. Coronal single shot fast spin echo image shows a metastatic lymph node. So, I guess this brief description has given a picture on how a MRU works. In conjunction with our case study, I have found an article which has given a justification about a smart sensor which is used to detect kidney disease, a portable color sensor based urine analysis system to detect chronic kidney disease. This system provides an early diagnosis of the disease. The sensor detects the change in color on the stripe of urine sample. The TCS3200 is a color sensor which detects the presence of albumin in urine and converts light energy to current. The current is converted into square wave frequencies using a current which is proportional to light intensity. Finally, by exploiting the Arduino board, a square wave is observed as a result. This method helps detection of kidney disease in a very early stage so that the patient can be treated earlier and prevent further complication. I find this system a useful one to help people bring awareness to their health and give an extra care. Thank you.
Renal biopsy. A renal biopsy is a procedure used to extract kidney tissue for laboratory analysis. The word renal describes the kidney, so a renal biopsy is also called a kidney biopsy. The test helps your doctor identify the type of kidney disease you have, how severe it is, and the best treatment for it. A renal biopsy can also be used to monitor the effectiveness of kidney treatment and see if there are any complications following a kidney transplant. There are two ways to perform a renal biopsy. First one is percutaneous biopsy, renal needle biopsy. For this procedure, a doctor inserts a thin biopsy needle through the skin to remove your kidney tissue. They may use an ultrasound or CT scan to direct the needle to a specific area of the kidney. The second way is open biopsy, surgical biopsy. For this procedure, your doctor made a cut in the skin near the kidney. This allows to physician to look at a kidney and determine the area from which the tissue sample should be taken. Proposal of a renal biopsy. Find the reason for an abnormal level of waste product in the blood. See if a kidney tumor is malignant or benign. Gauge how well a template kidney is working. Investigate the cause of hematuria, blood in the urine. Determine the cause of proteinuria, high level of protein in the urine. See the severity of possessive kidney failure and how quickly the kidney are failing. Create a treatment plan for disease kidney. Developing an infection after the procedure is a serious risk. However, this relapses always be on the lookout for symptoms that could incidence an infection after urinary biopsy. If you have clean red blood or blood clots in your urine for longer than 24 hours after your biopsy, cannot urinate, have chill or a fever, experience pain at the biopsy site that increase in intensity. Next, have redness, swelling, printing, or any other discharge from the biopsy site. Feel faint or weak. If symptoms occurs, please contact your doctor. Cost of kidney biopsy. The cost around the $16 to $214 in USA, and it is equal to ringgit Malaysia is 250 until 1,000. It is depend on factors such as doctor fee, age of patient, the medical condition of the patient, type of hospital, and any other lab test or examination tests such as X-ray, scanning. From this article, Gold Nano Practical Sensor for detecting chronic kidney disease and disease progression, we can know the recent advances in nanomedicine. Sensors were reported that were based on chemi-resistive layer for 4 types of spherical gold nanoparticle. The blood testing using gold nanoparticle sensor hold future potential as a cost-effective, fast, and reliable diagnostic test for early detection of CKD and monitoring of disease progression.
Choosing the right treatment option for you can seem very daunting when you have chronic kidney disease. There is sufficiently advanced for your kidney team to start talking to you about replacing your kidney function with dialysis treatment. Your decision needs to be guided by your personal lifestyle, support at home, and any other illness. Each type of treatment has its benefit and point to think about before you make a decision. It is therefore important that you are given information, advice, and guidance to enable you to decide on the treatment that best for you. And what is the function of hemodialysis machine? A hemodialysis machine is used in dialysis that filter a patient's blood to remove excess water and waste products when the kidneys are damaged, dysfunctional, or missing. The dialysis machine itself can be thought of as an artificial kidney. How does a hemodialysis machine work? Your blood is taken out of the body and travels around a dialysis machine and through a special filter called a dialyzer. The dialyzer cleans your blood of waste products, removes any extra fluid, and the cleaner blood is then returned to your body. You may have the question, how long each treatment lasts? In a dialysis center, hemodialysis is usually done 3 times per week for about 4 hours at a time. People who choose to hemodialysis at home may do dialysis treatment more frequently, 4 to 7 times per week for shorter hours each time. Few advantages of hemodialysis. And the first point is hemodialysis requires less time than peritoneal dialysis. Second, hemodialysis carry a relatively low risk of infection. Third, hemodialysis requires less surgical interventions. On the other hand, it also has its own disadvantage. First, you must travel to dialysis center may be required 3 times a week. Second, patients may not be able to set their own treatment schedule. Third, permanent access requires usually in the arm for adults and the neck or chest area for children. Fourth, neither are required to access to fistula. They also have side effects of hemodialysis, And the first one, which is low blood pressure. The second is sepsis. The third is muscle cramps. And the last one is itchy skin. The price of hemodialysis machine and cost of treatment. The machine price is around 40,000 to 60,000 in ringgit. And the average cost of treatment for each patient is more than 25,000 a year. This article ponders upon wearable medical measurement device in relation to chronic kidney disease and associated comorbidities and whether this might benefit CKD patients. We aim to map the intersection of nephrology and wearable sensor technology to help technologists understand medical aspects and clinicians to understand technological possibilities that are available or soon will become so. The important findings for wearable sensor. Wearable medical devices are highly associated with the term telehealth, a collection of means or methods, not a specific clinical service, to enhance care delivery and education. Within the telehealth field, optimistic technology push publications are abundant, whereas studies on reasons why telehealth projects are discontinued are rare, but precisely, this provides extremely valuable lessons, important general findings for wearables. Applicable to all three clusters are: first, extra attention for risk analysis. For any medical device, risk assessment is mandatory, but for wearable device intended for use in daily life, the risk assessment must cover a wider variety of scenarios. The IEC safety standard on medical devices for home use explicitly lists many points of attention for wearable. IEC term body-worn device. Second, practical added value for all involved parties. The measured parameters should indeed form a useful and recognizable contribution to quality of life for patients, be perceived as a useful tool by nurses and doctors, and be cost-effective for healthcare insurers. Obtained measurements should be reliable, or if reliability fluctuates, at the least a level of confidence should be indicated. Gimmicks initially may be appealing, but if no practical added value is perceived, patients will cease wearing them. Thirdly, unobtrusiveness. A wearable should not become a burden. Only patients can make the final judgment whether gain in their daily life outweighs any discomfort from the device. Fourthly, regardless. Wearable ideally should increase patients' freedom to move around and perform their normal daily routines. Instead of being limiting, data should be large enough to withstand being dropped on the floor, bang against a door, or get wet in the rain. The worldwide IEC standard for medical devices intended for use at home and in other daily life specifically state that for wearable outdoor use is reasonably foreseeable and requires at least an IP22 protection level, protection against injury of fingers or similar sized objects. Also, vertically dripping water shall have no harmful effect when the enclosure is tightened at an angle up to 15 degrees from its normal position. The fit, user-friendly and hassle-free. Most CKD patients are old and many have diabetes with numb fingertips from blood sample needles and or impaired eyesight. Also, rheumatism, tremors, impaired vision, and low hand strength rest the bar when designing wearables. For this patient group, great attention is needed for easy battery charge or exchange, and for battery life maximization, screens should be well readable and control should be intuitive and feel good. The applicable IEC standard contains numerous requirements like this, and in the accompanying rational section also explain the background for these requirements. The SAID, connectivity and cybersecurity. Wearable will go everywhere with the wearer, and almost always will have a form of mostly wireless connectivity. This implies and specific and true precaution must be taken to warrant correct storage and transfer of data and protect privacy. The last one, smart automated recognition of meaningful event. In the early year of ECG Holter recording, cardiologists would have to visually scan many hours of ECG threads for abnormalities. Nowadays, Holter recordings are automatically pre-analyzed and physicians only have to judge the highlighted anomalies. It's clear the long-term recording of a plurality of various patient parameters even more needs to be pre-processed and scanned for meaningful pattern to avoid drowning clinician in a flood of ray trace. So in the conclusion, for the management of CKD and associated complications and comorbidities, wearable monitoring devices offer a wide range of opportunities to optimize, mitigate CKD progression speed, and maximize quality of life. And the main challenge for the development of wearable technologies are human factor engineering and creating a care model that is attractive to healthcare providers, patients, and especially paying parties, healthcare insurers. Early involvement of all these three parties is crucial for success in the wearable sensor device.
Renal scintigraphy, also known as renal scans, refer to several examinations using radiopharmaceutical that evaluate the function and anatomy of the kidneys. Renal scintigraphy is one of many imaging methods used to evaluate the kidneys. How renal scintigraphy look like? How its function? A renal scan uses a machine called a gamma camera and a special liquid called radioactive isotope to make picture of your kidneys. The liquid is injected into your veins and pictures are taken using a gamma camera. This takes about 20 minutes. The liquid will pass out of your body in your urine or stool. How its purpose? Renal cortical scintigraphy detects the amount of functioning renal cortical tissue through images taken with a gamma camera approximately 2 hours after radiopharmaceutical injection. Renal perfusion and functional imaging examine blood flow to the kidneys and identify potential narrowing of the renal arteries. Through a series of images taken over 20 to 30 minutes immediately after radiopharmaceutical injection, diuretic renal scintigraphy detects kidney blockage or obstruction of urine flow through images taken before and after the introduction of diuretic to move urine through the kidney. Risk of it. First, the NM renal scan can take 45 minutes to 3 hours. Second, it is exposed to radioactive radiation wave. Lastly, you should not eat or drink before the operation of the procedure started for a long time period. Advantages. It is useful in evaluating the physiology function of the kidney by monitoring flow radioisotope and how efficiently the kidneys absorb and pass air. It shows abnormalities in the structure, size and shape of the kidneys. The radioisotope material helps to differentiate between passive deletion and obstruction. Disadvantages. It produces lower contrast image than KUB X-ray, CT and MRI and may require further tests to clarify diagnosis. Next, time consuming. A typical scan takes 30 to 2 hours. Requires nuclear reactor producing radionuclide to be closed. Differentiate between Cs.